Is there any sense that, I mean, as we've had some acceleration on uh, scientific research focused on coronavirus, that that may help cancer research too as we go forward? I mean, I've heard from some that there's speculation that because people have to move quickly, we're actually seeing some more movement across the board. Do you think that might happen?
Yeah, I mean, I think so. I mean,
Okay.
there have been new funding opportunities open
Okay.
for coronavirus, for
Uh-huh.
cancer, for research that uh, you know is between both those fields.
Uh-huh.
Cancer patients tend to be at greater risk in the sense that they
Sure.
tend to be immunocompromised and older, and they have comorbidities.
Mm-hmm.
Um, it has forced us to really, think about kind of basic first principles. How can we, um, take care of our patients both in terms of their malignancy and also in terms of a real, like a real world scenario of a pandemic.
Right.
Um, and then also, I mean, just kind of something I've been thinking about is the idea that could we use the technologies that we're developing for cancer, could we apply them to coronavirus as well?
Uh-huh.
For example, an idea I have is, could we use our liquid biopsy technologies that we're
Right.
using to try to understand, where the malignancy is coming from, how the
Mm-hmm.
malignancy is growing? Could we apply that to normal tissue that is
Hmm.
kind of being, damaged by coronavirus? And then could we anticipate, how will coronavirus affect people? Which
Right.
patients are at greatest risk, and what are the organs at greatest risk in those patients in a personalized fashion?
Right. It does seem like coronavirus seems to be, I don't know, unusually haphazard in terms of who it
Yeah, I
affects
mean, in
which
some
way.
patients I mean, in many patients it's affecting the lungs, but then you hear
Mm-hmm.
about patients who are having neurological symptoms. You hear about
Mm-hmm.
patients who are having, kidney symptoms. They're the childhood patients who have been
Mm-hmm.
getting, potentially getting predisposed to Kawasaki syndrome.
Yeah. Yeah. So
So, I
it's kind
mean,
of all over the board.
I agree with your word of being haphazard. And I think sometimes it's hard to anticipate what it will do. And I wonder
Sure.
if some of the diagnostic technologies that we're trying to develop in the lab could help address some of that.